Wait, did you say there are new changes to Medicare Part B in 2023?
Yes, it took a few decades, but Medicare finally woke up and is making 3 positive changes in 2023. Stay tuned and learn how you can take advantage of and benefit from these changes.
And be sure to stick around to the end of the video, where we will also discuss what changes you need to be aware of to your Part C and Part D of Medicare as well. So change number 1 that will affect all of you is the Part B premium. Now, we are not talking about Part A, which is the hospital part of Medicare. Instead, Part B has to do with medical costs, such as doctors, labs, ambulances, surgery, and so forth. As you can see from the chart, the Part B premium typically goes up every year. Multiple reasons can affect the Part B premium increases. The main factor is what Medicare projects it will cost to cover someone for medical benefits. As you can see from this chart, the premium increases are not drastic, with some years even staying the same. So why the 14.5% increase from $148.50 in 2021 to now $170.10 in 2022?
Well, it had to do with a new drug called LGM.
Now, one biotech company thinks it's cracked Alzheimer's tricky code in a drug known as aducanumab, now sold as Aduhelm.
This is an approval for Biogen. This is a huge stock event. It's a 50% pop on this FDA approval.
But Biogen has reported only a fraction of estimated sales. The company's share price has nearly halved.
Medicare had indicated that half of the Part B's 14.5% increase was set aside to cover the $30 billion that Medicare was expecting to pay Biogen in 2022 for LGM.
You can imagine there was much commotion over this significant increase in Part B, so much so that Biogen decided to cut the cost in half.
Now, how will the decrease be reflected in Part B's premium? Breaking news! As of September 27, 2022, the standard monthly premium for Medicare Part B is $164.90. Yes, 90 cents included. This is slightly over a 3% decrease, or $5.20 less per month compared to $170 from 2022. Now, this decrease will be the second time in the last 20 years. We'll take it. Yes, friends, we do feel that with the whole LGM drug controversy and the huge 50% reduction in cost Biogen gave, the cost should have been equally reflected and brought the cost closer to $159. But what can we do? We can at least celebrate that it did go down to $164.90. So go get your Starbucks coffee with those savings. Well, sorry, I guess I gotta think about it. It's a small savings, so maybe a small cup of coffee. But we'll take what we can get.
Now, let's go into the following 2 most significant changes: IEP, or Initial Election Period, and GEP, or General Election Period. Now listen carefully, as this will affect many of your peers and family members. The Initial Election Period, or IEP, is for those that turn 65. You have 3 months prior and 3 months after to enroll. Most people never enroll past 3 months unless they are still covered through work.
Now, if I may, let's take a little detour here. If you're over 65, still working, and covered through an employer, then you don't use IEP. You will still use the Part B SEP, or Special Enrollment Period with a loss of employer coverage, as your special event. If this is you, you will have 8 months from the loss of credible health coverage and employment, yes, the combination of both employer coverage and employment, to enroll in Part B. Now, most of our clients never use those 8 months since they would be without coverage during those months. We will leave links with more information below regarding this. Now, if you're still working past 65, it's best to call us a couple of months before you retire. That way, we can help you enroll in Medicare smoothly and stress-free. Remember, we represent over 30 different plans all over the country and do not charge for our services. We get paid through the insurance company just like your car insurance agent gets paid. So, what's the big change in IEP?
Well, the current rule is if you delay Medicare 1 month past your 65th birth month, the Medicare will delay your effective date by 2 months. If you delay Medicare 2 months past your 65th birth month, the Medicare will delay your effective date by 3 months.
Confused?
Yes, all of us were confused when Medicare introduced this ridiculous rule a few years ago, most likely to deter people from saving a few bucks and delaying Medicare. Well, here's a positive change. Medicare finally woke up and realized that rule made such a mess and caused so many complaints that they decided that starting in 2023, people's effective date would no longer be delayed. Instead, it would just start the following month.
So if you enroll the month you turn 65 or anytime within the 3 months after your 65th birth month, your effective date will be the following month. So let's say your birth month is April and you enrolled in Medicare in May, then your effective month would be the following month or June. No more confusion.
Yes, but please be aware that you could have a gap in coverage by delaying Medicare within those 3 months after you're 65. How? As we know, anything with the government takes a while. We have seen people enroll in Medicare during their IEP, and it took up to 3 to 4 months to get approved or to finally get their card. The quickest we have seen people get their Medicare number or card is around 2 to 3 weeks, but that's rare. And true, in many cases, Medicare will honor your next month's effective date, even if you don't get your card, but you might not have coverage from the 20% or the Part A hospital deductibles that Medicare does not cover.
Exactly. See, the reason is no insurance company that sells a supplement, Medigap, or Advantage plan will take your application unless you have a Medicare number.
Right. We had a client back a few years ago that did delay his Medicare, and by the time he got his Medicare number, he had already been in an accident while working on his house. Now, Medicare did cover him for the month requested, but he was stuck with the 20% since he did not have his Medicare number, and we couldn't start the supplement for him on the month that he wanted.
Yes, I remember that very clearly. So friends, while it might save you a few dollars in delaying Medicare 1 to 3 months after you're 65, are you willing to take that chance that anything can happen?
Yeah. Here at KCIIS, we will not pressure you to start on a specific date. However, our goal is to give you unbiased clarity regarding your rights and options, along with helping you to see what the consequences are if you make a specific decision.
Now, if you found value in this video so far, please let YouTube know this is a worthwhile video to recommend by clicking on the like button below and subscribing to our channel. Now let's talk about the last significant change in the election period, GEP, or General Election Period. We call this the Part B Oops period. Now, why do we call it the Oops period? Oops, I should have enrolled in Medicare during my IEP, but I decided to delay Medicare and save a few dollars. Now I got sick and I want to enroll in Medicare. So Medicare knew that some would delay Medicare since they are healthy. Yes, Medicare would allow enrollments for those that wanted to delay their Medicare from January 1st to March 31st of every year. However, Medicare would not only hit you with a monetary penalty per month, but also delay your Part B effective date and not start it until July 1st of that year. Yes, this is another delay in your Part B effective date. However, please understand that if you sign up during the GEP, again January 1st to March 31st, and you do not have a special event, then you will have a per month penalty. That's 10% per year times each year you could have signed up. Yes, a per month for life penalty.
Confused again?
Well, no need to be anymore. Here's the good news. Medicare woke up and realized this had been confusing the public for years. And starting in 2023, they will no longer delay your effective month into July. Your effective date will now be the following month. So simple. It only took Medicare a few decades to figure this out. Just don't forget that 10% penalty per year still applies if you delay your Medicare.
However, you only have January to March of each year to enroll in Medicare Part B if you've missed your IEP and have no special event. The safest decision, if you know you will not have a special event, just don't miss your IEP.
Yes, thanks, Anne. Wow, so strict. Now for the bonus ending. Are there positive changes to your Part C, which is your Medicare Advantage plan, or Part D, your Medicare Drug plan, where there are 3 things that you need to know?
Okay, number 1, know what type of health plan you have. Do you have a Medicare Advantage plan or a Medigap plan? Do you also have a Part D prescription drug plan? Again, if unsure, check the other links and look for our other videos.
Number 2, make sure you look through your ANOC. What's ANOC? That's your annual notice of changes.
Now, a reminder, this does not apply to standardized Medigap or supplemental plans. These plans are not allowed to change their benefits. For example, Plan N, Plan G, or Plan F benefits will stay the same yearly. Since Medicare is a primary, there are no changes to your network of doctors or hospitals required by the insurance company. You might have a rate increase, but those typically happen once a year during the anniversary of your policy. So unless you started your policy on January 1st, your increase will generally be the month your policy first started each year.
That's right. So don't go on vacation until you check your ANOC. You should receive your ANOC right around October. If not, call your insurance company located in the back of your card. If you have a Part C or Medicare Advantage plan or a standalone Part D prescription drug plan, check for these changes. Changes to your new monthly premium, deductibles and copays for doctor visits, hospitals, and so forth, maximum out-of-pocket, network of doctors and hospitals, what additional benefits like dental, vision, gym memberships are available or no longer offered. Regarding your drug plan, look for medications that are covered and no longer covered, deductibles and copays for those medications.
If you do not like the changes you see, call us and we'll shop around.
Number 3 is do not get caught up in FOMO or the fear of missing out. Do not get caught up with the commercials that make you feel like Medicare is making so many changes by adding dental, vision, hearing aids, gym memberships, and so forth. Those extra so-called free perks refer to Medicare Advantage Part C plans, and not original Medicare or Medigap plans.
Well, did this video help you avoid all the misleading ads and prepare yourself for Medicare changes in 2023? We would love to hear your comments below.
Remember, knowledge is power, and we hope you will feel confident in your retirement years through all of our guaranteed income and healthcare videos.
If you found value in today's video, please click on the like button below, subscribe, and share this with others to help them be prepared as well. And we thank you as always for taking the time to watch our video. See you in our next one. Bye.